Many of you ask me whether MRCP is equivalent to MD Medicine in India, whether you can take the MRCP instead of doing NEET PG, whether there is any advantage of doing MD Medicine before coming to the UK, or what are the advantages of doing MRCP in India. Hello and welcome to my channel guys. I am dr.aparajita.roy and I am working as a registrar in King's Hospital London, and in today's video I am going to discuss all these points so that you get clarifications to all these questions. I have done my MD Medicine in India before completing my MRCP in the UK. So if you are in any doubt which career path to choose, I can give you the exact information that you need to make the right career decision. So please watch this video till the end to get all this information and much more. So let's get started. In order to better understand the medicine training programs in UK and India, you must watch my 3-part video series from start to end. In today's video, I will talk about MD Medicine versus MRCP UK. In the next video, we will explore how to prepare for NEET PG and MRCP UK exam parallelly. And in the final part, we will discuss how the medicine training in India compares with the same in the UK. Together, these 3 videos will clarify all your doubts regarding medicine training in India and UK. So, the first question is whether MRCP in the UK is equivalent to MD Medicine in India. If I have to answer the question in one word, my answer would be no. Now, why is that? Let's explore. The MD Medicine program from India is a 3-year training program for which you have to pass a very rigorous entrance exam, that's the NEET PG, following which you have to undergo training for 3 years, which would include academic training and clinical experience. Following that, you have to pass another rigorous exit exam, which is the MD final exam. Now, the 3-year training program is extremely rigorous, guys. It includes a lot of work like seminar, journal club, thesis, publications, along with a full-blown clinical job that would include managing inpatient and outpatient departments, on-call shifts, etc. This will also train you to make independent as well as supervised decision making. Okay. Now, in the UK, this medicine training program is called the IMT or the Internal Medicine Training, which is a similar 3-year training program, but the structure of the training programs are very, very different. In the subsequent videos in this 3-part video series, I will discuss in details about the IMT training and how it compares with MD Medicine. So please keep watching this video as well as the 3-part video series till the end. Now let's look at MRCP. Now on the other hand, MRCP is a membership exam. So by passing this exam, you get a degree certificate. In order to pass this exam, you have to have clinical experience. How you get that clinical experience is entirely up to you. Whether you get that clinical experience from MD Medicine or from non-training jobs, that does not matter for MRCP. So, the MRCP gives you an academic degree, but it does not give you any clinical experience as such. That is because MRCP exam, unlike MD Medicine, does not offer any training. So, why should we do MRCP at all? What are the advantages of doing MRCP? Let's look into that. The biggest advantage of MRCP UK exam is its global reach. It opens doors for you not only in the UK but also in many other countries, especially in Middle East. In India, especially in the corporate sector, MRCP is highly coveted and highly respected. If you want to work in the UK, MRCP is one of the pathways for obtaining GMC registration, which is a must before starting clinical work in the NHS. MRCP is also an entry-level criteria to start UK specialty training, that is CCT. But please remember, only passing MRCP UK will not do. You also have to have the right competencies that are required to enter into training. So, if you don't want to enter into training, you can still work as a locum consultant in the NHS with your MRCP degree if you have substantial clinical experience. More than anything else, the biggest advantage of doing MRCP is that it makes you a better doctor. Hands down. It makes you smart, it makes you quick, it makes you wise. But for me, the biggest selling point of doing MRCP is that it has taught me how to talk to a patient. So in my MD medicine curriculum, there was no emphasis on patient communication. But after doing MRCP, I have completely changed the way I interact with my patients. The disadvantages of doing MRCP UK is that it is an expensive exam. So if you are not keen on coming and working in the UK, or you're happy with your practice in India, I would say only MRCP UK does not have much value addition. Is it difficult to pass? I would say no. With the right guidance and right strategy, as I keep saying, it is very easy to pass. MRCP UK, like I said, without MD in India does not have a very good value addition. It's not recognized as a postgraduate qualification in the government setup in India yet, but like I said, in corporate setup, it is highly respected. But the biggest disadvantage is this degree is of no value if you don't have clinical experience. So remember, in a busy night shift when it's just you and your patient and you are leading a team of nurses and junior doctors, it is your clinical experience that will bail you out, not your MRCP degree. Okay, the next question is there any advantage of doing MD medicine before coming and working in the UK? Also, is MD medicine compulsory before coming and working in the UK? Is it necessary to do MD medicine before doing MRCP? Let's delve deeper into these points now. For me, MD medicine is the gold standard for learning medicine. You cannot have a better degree to learn your theory and practical skills. It gives you immense confidence, and once you have done MD medicine, it is said that you can face any patient setup or any emergency anywhere. It is also a very structured program. There is a thesis, there are publications, seminars, journal clubs, and after doing MD medicine, you can start working as a junior consultant in medicine in India. But what about in the UK? Now, the most important point is MD medicine recognized as a degree in the UK? There was a petition that was submitted a few years ago that GMC should recognize Indian PG degrees like MD and DNB. Unfortunately, this petition was rejected. This said that GMC would not be able to accept Indian MD and DNB as an acceptable overseas qualification. Now, this point is very, very important, guys, that Indian MD is not recognized as an MD in the UK. You have to understand that the definition of MD in UK is very different from the definition of MD medicine in India. In order to qualify as an MD in the UK, you have to have a supervised research degree for over 2 years or 4 years if part-time, and that is usually done at a much higher level, like when you're a senior registrar or a consultant. But even with an Indian MD degree, you have a lot of potential. Now, what are the advantages of MD medicine in the UK? Let's look into that. Most importantly, if you're applying for non-training jobs, the interview panelists will respect and understand an Indian MD medicine degree because the doctors in the UK are well aware of how rigorous and extensive the Indian MD medicine program is. If you are applying for higher specialty training, you can claim extra points on the basis of using MD as a postgraduate qualification and will also get extra points for publication, for teaching experience, and for any poster or oral presentation that you may have done during your MD medicine training. Okay then, now let's talk about DNB. In India, many doctors do DNB instead of MD medicine. Now, what about DNB? Similar to MD, it is not recognized officially in the UK as a postgraduate qualification. Also, please ensure that you have done your DNB from a good institution where you have got exposure to a wide range of clinical cases during your training. Like MD Medicine, you can still claim points for posters, presentation and teaching experiences that you may have done during your DNB training. So the next question is, MD and MRCP, can you do both? And is there any value addition if you do both? Let's have a look. In my opinion, this is the best possible scenario if you want to come and work in the UK. Do your MD and then complete your MRCP and you can work anywhere, be it in India, UK, Middle East. Even if you want to apply for specialty training in the UK, that is CCT, as we discussed, MD and MRCP is an excellent combination. And trust me, it is not difficult at all. As I keep saying, with the right strategy, with the right guidance, you can definitely achieve this. And this is exactly what we will discuss in our next video. That is how you can prepare for MRCP UK exam while you're preparing for NEET PG. So please don't forget to keep watching this space for more updates on this. That's it for today, guys. I hope this video was useful. Please let me know in the comment section below how you found this video and what other topics you would want me to make videos on. If you like this video, do give me a thumbs up and subscribe to my channel so that I stay motivated to bring more such up-to-date content to you. Till then, stay safe, keep studying and ace your MRCP.